Very good morning to all of you. First of all, let me congratulate my batchmate and I call him Tiger of 1978 batch from our medical school in Patiala, Dr. Vittal. He actually has a lot of enthusiasm in him to get people on a platform to make them talk and to make them talk on issues which are relevant, on issues which are pertinent, and on issues which will have some outcomes. Any conference, if it is just diarrhea of words and constipation of thought, maybe is not the right podium for the way we are going about in the conferences. Without surmising any further, I thank the organizing committee and I thank Vitul for giving me a chance to be here. We have very senior people here, Professor Manchanda. Really, it is, I would say, a treat to be talking in front of him. And we have, my friends, Dr. Atul is there, Dr. Harish is there, Dr. D.P. Sharma is there, and a lot of you whom I have interacted through many years. At any point of time, I would not say that I am an expert on this, because by the way, the definition of an expert is a person who takes your watch and tells you the time. And I am convinced after putting in a lot, almost 30 years in medical education, that invariably regurgitators, obscurfators are not the right type of teachers. The teachers have to be facilitators who just take your hand, take you on the path, then you choose your path and learn about it. Without going anything into more detail, I have chosen this topic to talk on tropical diseases and the liver. I bring good wishes from our institution, which is a 1700 bedded hospital and situated in Ludhiana. Tropical countries, all of you know, are the countries which are between these two lines. Tropical diseases are neglected. They are killing India. And they have been traditionally ranked very low on national and international forums. A hepatocellular carcinoma, a liver transplant, a cardiac stenting, or other things which have high turnover value in terms of materialistic commercializations, I would say, or in terms of our understanding that these are more important than the other things, get the main brunt of the focus, whether it is international forums or whether it is national forums. But unfortunately, diarrhea, malaria, dengue kill more people than most of the diseases. I was at the Royal College of Physicians in London and talking about dengue, and I asked the audience, there were about 200 people, what is the lifespan of a Aedes mosquito which affects 2/3 of the world's population. 2/3 of the world's population is affected by dengue. उसको जो करता है एडीज इजिप्टाई मच्छर, उसकी लाइफ स्पैन क्या है? कोई रॉकेट साइंस नहीं थी. I didn't get the answer. It was unfortunate. But if you had asked them something about molecular medicine, translational medicine, genetics and epitomes, ribosomal and microsomal systems are working, they would tell you this. I read this. So we have to really, at least in a developing country like India, have to come down to the roots and understand the problems and try to think what are the things we need to be focusing more on. I am not saying at all that don't focus on the other things. Non-communicable diseases need a lot of focus, no doubt about it. But communicable diseases which are almost, there is a possibility which is very high of preventing them. If you kill the mosquitoes, you will not get dengue, you will not get malaria. If you get down your cholesterol, you might still get coronary artery disease. If you get down on your injectables, you might still reduce hepatitis B. So these are the things we need to be talking about. What the tropical diseases with hepatic involvement I have taken into consideration because we have the viruses, hepatitis A, B, C, D, E. Obviously, we have a long list which has gathering momentum every year. Then we have dengue fever, bacterial leptospirosis, tuberculosis, leprosy, enteric fever, parasitic amoebiasis, hydatid disease, malaria, schistosomiasis. This list is by no means complete, but these are the important ones statistically in terms of morbidity and statistically in terms of mortality in our country. I will not be able to take all of them, but the hepatic manifestations can range from anecdotic hepatitis to obviously hepatic encephalopathy or chronic liver disease leading on to problems. There are various manifestations you can see in this busy slide, though not a very good slide by my standards because of my tryst with medical education. Anything on a slide which has more than 4 lines to me, that means the person wants to talk more than the audience can understand. So this is not very good slide, but at the same moment I'll seek forgiveness from you. But dengue, leptospira, rictitial diseases, malaria, they have almost similar type of presentation. Fever hoga, myalgia hoga, sir dard hoga, conjunctivitis hoga. So there is very little to choose in symptomatology about these things. I will be stressing on dengue for obvious reasons, and I like to have your comments on this. And we just had floods in 2/3 of the countries, I think. Will the floods lead on to more of dengue? Well, I was amazed when somebody from the National Vector-Borne Diseases talked to me that the larva would not grow if the water is in a contact with soil. That means a flood में larva grow नहीं करेगा. लार्वा जो ग्रो करेगा वो क्लीन वाटर में करेगा और मैन मेड चीज़ों में करेगा. आपके जो बर्तन हैं, आपके जो पॉट्स हैं, आपके जो रबर टायर्स हैं, उनमें जब पानी इकट्ठा होगा तो वहाँ पर होगा. बिकॉज आई आस्क्ड द लेडी हु वाज वेरी सीनियर पर्सन विद द नेशनल वेक्टर बोर्न डिजीज, व्हाई डजंट दिस हैपन? शी सेड दैट देयर इज सम अमाउंट ऑफ एरिएशन विच कीप्स ऑन हैपनिंग व्हेनेवर द वाटर इज इन कॉन्टैक्ट विद सॉइल. जैसे सारे विलेजेस में जाएंगे टोबे तो होंगे ही हैं. देयर लॉट ऑफ all villages have a talab, toba and things like that. So larva don't normally grow in that. Larva would grow in a area which is man-made. Now this is the next, this is the number of patients, and you can see that the way it is rising. I want to take a minute on this. This is the 2017 data. Punjab reported 3,000 patients. In 2017, the national figures of dengue from Punjab were 3,000. And once I show you a single institution proven cases of dengue, I would not say the data presented by the government is wrong, because now as you grow up in age, you only want people to read between the lines rather than give them the lines. Now if you see, I'll just come to that and then refer back to the slide which is here, which was 3,000 patients from the whole of Punjab. Now, WHO classification in the 90s was dengue fever, dengue hemorrhagic fever, DSS, dengue shock syndrome. They have changed it over to non-serious dengue or non-severe dengue and severe dengue, and in between they have put in the warning signs. And fortunately, if you see, the warning signs are all related to my specialty, which are almost gastroenterological. They are abdominal pain, persistent vomiting, fluid accumulation, ascites, mucosal bleed, मुंह में से, liver enlargement, and GI bleed. These are warning signs of dengue. So if you remember a gastroenterologist, and a dengue patient has GI symptoms, please think again that complications are likely to be happening. The other thing is, which I wanted you to know is, how many of you could conclusively in the audience tell me, when do the platelets start decreasing, on what day of dengue? Very simple question. First day, second day, third day, fourth day, fifth day, sixth day, seventh day. Okay? Third day, fourth day, very good. So, you are almost near the mark, and the easiest way to remember for people is that India got independence in 1947. यार ये भी सोचने की बात है कोई, ये तो सोचने की बात नहीं है. This only shows that my monotonous talk has put you into sleep after eating those chola bhaturas outside. By the way, the bhaturas were very nice, thanks to Vital. So 1947, 4 and 7, from day 4 to day 7 is once the platelets will decrease. So there is no point of getting platelets on day 1. 90% of people get platelets on day 1, day 2, day 3 and कराई ਜਾਂਦੇ ਹੋ जब तक. ਉਹਨਾਂ ਦਾ ਫਾਇਦਾ ਕਿਹਦਾ ਹੁੰਦਾ? ਇੱਕ ਲੈਬ ਵਾਲਿਆਂ ਦਾ ਹੁੰਦਾ ਬਸ, ਪੇਸ਼ੈਂਟ ਨੂੰ ਉਹਦਾ ਕੋਈ ਫਾਇਦਾ ਨਹੀਂ ਹੁੰਦਾ. So that is the area which we have to be little worried about. In the pathogenesis of why do we get a problem in dengue? We have a T cell mediated process, direct cytopathic effect, interaction between antibodies and endothelium, cytokine storm, non-specific effects of shock and hypotension, and host factors. Some people do not get dengue. We have to think about it. I was last week with ex-principal of ours, and he is very fond of Ayurveda and homeopathy. So he took me and showed me some pots. वहाँ पे प्लांट्स लगे थे, मेरे को प्लांट का नाम भूल गया. मेरे को बोलते हैं, डॉक्टर साहब आपको पता है ये कौन सा प्लांट है? मैं कहा सर याद तो नहीं है, गूगल लेंस लगा के अभी बता देता हूँ आपको. सो गूगल लेंस से फ़ोटो खींची, उसने नाम बता दिया, कहते वेरी गुड. सो प्रोबेबली इन द 21st century, remembering things which our forefathers, our teachers thought, that is most important in teaching and education, may be less important than knowing from where to get the facts. So why I am saying this? Because he had a pot which उसमें प्लांट्स लगे थे. वो कहते हैं हमारे मच्छर ही नहीं आते घर के आसपास. वैसे प्लांट्स क्यों नहीं लग सकते सारी कंट्री में, मुझे नहीं पता. भाइयों और बहनों को आग्रह करना पड़ेगा कि ऐसा करें, जल्दी करें तो ठीक हो जाएगा. So these are the pathogenesis. Now this is what I was trying to tell you. See, in 2005, maybe people didn't know about our institution. This is how the graph started going up. 3,000 patients, 3,000 patients. Fortunately, the dengue season has not started yet, so the figure is so low. But see here, I was talking to you about 217. So, in a single institution, proven cases were more than 2,000. How is it possible that the whole state will have less than 3,000? To my mind, there were more than 30,000 or 40,000 unreported patients which have gone there. But now the crux is, once we don't report adequately, we don't think of the problem is big enough. If we don't think the problem is big enough, the actions taken by the great people sitting on the citadels of excellence in secretariats and health ministries become slightly changed. Because obviously they will have to take action when things are properly presented to them. This is the problem, look here, this is going to kill a lot of people. Now just few lines about the liver function tests in patients with dengue fever. This was the paper which we had published in the WHO bulletin. This was a study which we did in approximately about 200 plus patients. You can see clearly that dengue fever is the majority, does not require a great amount of treatment. Now other symptoms are fever, myalgias, all these things which you are very well aware of. Hepatomegaly, what we found, was seen in about 10 to 12% of the patients. But if the liver was enlarged in dengue fever and you were able to pick it up clinically, then think that you are dealing with a slightly serious type of a dengue fever and give it a little more importance and thought. Now the transaminases increase in almost 93 to 97% of the patients. What we saw in our patients was that the transaminases were almost rising from day 2 itself. Other authors and other investigators have found that it rise much later. People from Sri Lanka have found around the 7th day, people from Thailand found around 8th to the 14th day. But in our experience, they start almost rising by the 2nd day, and as the platelets are falling, 4th to the 7th day, 1947, 4th to the 7th day, the OT-PT also are very highly conscious of the liver involvement. Now, why AST tends to be greater than ALT? There is excess release of AST from damaged monocytes during dengue infections. Now we saw what 3 to 10 times, this was the AST, this was the ALT, and you can see 3 to 10 times was the increased most commonly seen. Now LFT in relation to severity of dengue fever. Once we looked at this, the significant derangement of LFT whenever there is a serious dengue happens. LFT means SGOTPT, other things we'll take into consideration. This is again slightly busy slide, but it only shows you that these are the biochemical tests. This is dengue fever, dengue hemorrhagic fever, dengue shock. So this is the most complicated form of dengue. And if you see now, whenever you compare this with the other two, then obviously you can make out that the significance of the things is happening. That means once you compare dengue shock with dengue hemorrhagic fever और नॉन सिवियर डेंगी आजकल की डेफिनेशन के हिसाब से, उसमें चेंजेस जो हैं स्टैटिस्टिकली सिग्निफिकेंट चेंजेस दिखती हैं आपको बिलिरुबिन में, आपको SGOTPT में, एंड इवन इन PTI. Then we also compared various groups like patients presenting with hemorrhage, GI hemorrhage, primary, secondary dengue infection, survivors, non-survivors. So if you look here, people who did not survive dengue, I feel sad if in 2019 people in our country die because of dengue. We have had a lot of understanding on dengue, lot of molecular work which has been done on dengue. ईटियोपैथोजेनेसिस कैसे हो रही है, मच्छर कितना आ रहा है, 20 दिन रह रहा है, 21 दिन रह रहा है, कहाँ से ब्लड आ रहा है, ब्लड फीमेल ही क्यों चूस रही है. Many of the people may not know that the female mosquito bites not because it likes to bite, but because that blood is needed for the ovulation process to be completed in the mosquito's life cycle. That is why the males don't bite. I don't know whether it is true for human beings because we have, is it true? Because there is a male population I see. You agree? He is my class fellow and he is laughing. He says males also bite. So, okay, so what we were talking about is, it is statistically significant here in survivors versus non-survivors, all these things. Bilirubin, AST, ALT, alkaline phosphatase. So किसी भी पेशेंट के अगर LFTs grossly deranged हैं, please, in a patient with dengue, please pay extra caution to it. That is the only thing which I am trying to tell you. Now this is the dengue fever groups, this is the ALT levels, this is the alkaline phosphatase level. Now if you see, bilirubin increase in patients with hemorrhage, secondary infections and non-survivors was higher than in other people. So if you have a jaundice in a patient of dengue, the warning signs are, I told you, are gastrointestinal, abdominal pain, ascites, mucosal bleed, vomiting, सारी पेट में ही है ना, पेट दर्द. और अगर उसके साथ आपको jaundice भी आ गया है, please be very careful about managing these patients. Now I have my own, I don't agree with many of the medicine people regarding giving of platelets on the basis of a platelet count, because platelet count is a number, it's not a platelet function. And unless in dengue you study the platelet function properly. Just giving platelet out of dengue scare syndrome, I call it DSS, dengue scare syndrome, and our institution takes I would say, the position of being one of the most important platelet, givers. And I tell, earlier the level was much less. 40,000 50,000 ਤੇ ਪਲੇਟਲੈਟਸ ਲਗਾਉਣਾ ਸ਼ੁਰੂ ਕਰ ਦਿੰਦੇ ਸੀ। ਹੁਣ ਐਟਲੀਸਟ ਮੈਂ ਸ਼ੋਰ ਮਚਾਈ ਜਾਂਦਾ, ਉੱਥੇ ਮਚਾਈ ਜਾਂਦਾ। ਹੁਣ 20 ਤੇ ਆ ਗਏ हैं। We will bring it down to 10, and I am convinced that unless there is a frank bleeding, platelets probably do not help. So just don't keep on infusing platelets and be very happy that you have managed. It is an antibody type of a reaction, and platelets are just temporarily there. To my mind, they don't have so much of this. So this is a study from Sri Lanka, just to tell you that on the 5th to the 6th day the OT-PT rise, and obviously this is the ratio. Why I have bought these slides is to give you that this is in addition to the scrub typhus. The scrub typhus is another thing which is coming up very much in our country, and we have to be aware of it, and we have to really keep our minds open about it. And I am convinced anything which is preventable, it is better to prevent it rather than treat a complication of it. Prevention is better than cure, just not because many of you are students of my father, Dr. Harcharan Singh. He had that community medicine thing, and he had a very nice voice control and much better in his eloquence and oration than I will ever be able to do in my life. And he used to tell me very clearly, you clinicians are the people who think that you will treat the diseases of the country. But it's not so. Unless you prevent, you will not reach anywhere. So anyway, coming back to this is from Sri Lanka study. Now this is a study from Thailand in 2016. Busy slide, it only shows कि OTPT बढ़ जाता है और AST भी बढ़ जाता है. This is a study from Pakistan, and why I have bought a study from Pakistan here is because they also get a dengue, but invariably जो सारे लोग बोलते होते हैं उससे उल्ट बोलते हैं ये लोग. So यहाँ पर भी what they are showing is something entirely different from what we are saying in terms of AST, ALT, OTPT rise, which is slightly different, but I don't want to put questions into this, but this is the way it happens. These are the various studies, and if you can see here, raised ALT ranges from 45 to almost 96% or 91%. In our population which we studied, it was almost 100%. So on day 3, if you get a OTPT in a dengue patient, don't be alarmed, they are likely to be high. Now the key points are hepatomegaly, liver involvement. Vitul, nobody has told me about the time. Gentlemen, I told you to tell me if my time is over. हो गया time over? अभी कितना पड़ा है? He says I have 15 minutes more. Audience does not agree. I started at 10:15. तो 15 मिनट थे मेरे पास. क्या टाइम हो गया? So we already skipped that. वैसे I have been in a medical school for such a long time, so I don't mind once I'm giving a talk and people start looking at their watches. कि बंद ही नहीं हो रहे. But I definitely mind once they take the watches to their ears and बंद तो नहीं हो गई कहीं. So मुझे लग रहा है अतुल was doing this, कहता बंद हो गई है. So this is the last slide. We have hepatomegaly and liver involvement are common in dengue. AST rises significantly more than ALT. Increased bilirubin is a bad sign. LFTs are significantly deranged in patients who have a severe dengue. Dengue fever should be kept in the differential diagnosis of acute hepatitis. I will not go into the details for this because of lack of time. And thank you so much, ladies and gentlemen, for giving me a patient hearing. We have last slide is this. Okay, there are challenges which all of you have to get together and face. I have listened to many people at many forums, invariably we have got into a tendency of blaming our country, our policies, and our protocols. And I totally would disagree with it, because the policies are made by the people and the people are you all. If we all as a group don't raise our voice, don't put our foot down, don't go on to the point that these are the things required in a country, in a developing country, rather than just aping वो जो अमेरिकन जर्नल ऑफ गैस्ट्रोएंटरोलॉजी वाले बोलते हैं जी, ब्रिटिश जर्नल वाले बोलते हैं, आपकी प्रॉब्लम्स अलग हैं, आपके लोग अलग हैं, आपका माइक्रोबायोटा अलग है। सर डॉक्टर मंजंदा से मैं डिस्कस कर रहा था, सो इसलिए आपके जो सोल्यूशंस हैं वो भी अलग होंगे। मेक योर ओन सोल्यूशंस। With these words, I'll end the talk. If there are any questions, we can take it up right now. Thank you, ladies and gentlemen.